Hello everyone, it's Brumby. Welcome back to my channel. So today we have a very interesting topic. A lot of people have been asking, I've been working in theatre for a few years, but I feel like I want to progress and get more clinical skills. How can I go about this? So today we're going to talk about that. So maybe you've done your ODP degree, you're already working in anesthetics recovery or scrub, but you feel like I want to get more clinical skills, and how can I go about this? How can I progress, and what courses are available for me? So this is the video for you, even for scrub nurses as well. So theatre nurses that work in scrub, anesthetics or recovery, this can be relevant to you as well. So the first thing I want to point out is there are two ways to progress. So you can progress going through to the band 6, which is a team leader, and band 7, which is theatre manager. So with those roles, you're more involved into the management role of the theatre. So you're overlooking how theatres are run, you're overlooking the team as well, how the skill sets are mixed, you're making the rota, which is very important. We need those people to run the theatre suite. But if you feel like this is not really for me and I want to progress more clinically, these are things I'm going to talk about and courses that are available for you. So I'm going to touch up on 4 courses that you can do that can help you get that clinical involvement satisfaction in a way. So the first thing I'm going to talk about is a bunch of courses. I'm going to group them together because they're quite similar, so that the video doesn't get too long. So the first thing is first surgical assistant or surgical care practitioner, advanced care practitioner. I'm just going to put them in the same group. So what are first surgical assistants or advanced care practitioners in theatre? So these are healthcare professionals that work directly under the supervision of the operating surgeon. They are more involved in the operating and the decision making. They can assist in holding the cameras. They can assist in retracting deep or superficial tissues. They assist in suturing, cutting sutures, hemostasis, suction, or other things. And also they're involved in the pre-op checklist of the patient, because as we know, the patient is to be seen before by the operating surgeon and make sure that they meet the criteria for the surgery. So these first surgical assistants and advanced care practitioners, they're involved in the pre-checklist of the patient. They also see the patient after the surgery, making sure that everything is okay, pain management, checking the wound site, just the whole physiology of the patient, that everything is okay. The third thing is they run clinics. So it depends with the specialty you're in. They're also involved in running clinics. So maybe after a few weeks, especially like in orthopedics, after a few weeks, the patient will come back to clinic to get the wound assessed and checked and x-rays to make sure that everything is healing fine. So sometimes advanced care practitioners can be involved in this part. They can be the ones running the clinic. This one is very good because during your training, it's a 2 years training. During your training, you will be earning money still at band 6. They'll be paying you at band 6 level, which is about 36,000. And after you graduate, after you finish your 2 years, you'll be on band 7 and you'll be earning at 43,000 pounds, which is, to be honest, that's a good jump from a band 5 salary, which is about 28 to 43, which is quite good salary. The second thing is most of the time it's, to be honest, all the time it's funded by the trust that you're working for. So you don't have to pay anything. You don't have to get any loan. The university and the trust will liaise between themselves, and the trust will be paying for you. So what are the requirements for you to do surgical care practitioner? So the first thing is you need your degree. Either you have an ODP degree or you have a nursing degree. The second thing is you need experience in the field that you're applying for. So if it's maybe spine surgery, you need to have worked in spine surgery, maybe as a scrub nurse. If it's orthopedics, you need to have been in scrub orthopedics. And most of them, they say at least 18 months of experience. So post-qualification, you've done 18 months of work before you can apply. The third thing is, this is very depending on your trust. So the trust actually says we need people to assist the surgeons. We need a surgical care practitioner or first surgical assistant. They put up the post, and you have to apply through the trust itself. So you don't apply to the university, you apply to the trust for a trainee post. So once you get your surgical care practitioner trainee post, then they join you to the university course. So the trust basically does the majority of the selecting. Once you're selected by the trust and you have a trainee post, then you get moved to the university. You get me? You can't apply to the university, you apply to the trust. then the trust join you with the university, if that makes sense. So it's very much dependent on your trust. We have to wait when posts open up in your trust, and also there is quite high competition because there will be people that have been working in that field for a long time and they've been waiting for this opportunity, and they don't come very often. It's not like a yearly thing that they'll come, maybe once every 2 years or 3 years, depending on where you're working. So first surgical assistant or surgical care practitioner role is very good for people who still want to stay in theaters, but they want to further widen their horizons. So because with surgical care practitioner, you're able to go to the ward to see the patients pre-op, you're also assessing patients after op, you're running clinics, but you're still coming to theater, you still get your theater time, and you have more clinical skills compared to when you're as an ODP. So it's very good for people who want to increase their skills more, but they still want to stay in the theater environment. You get me? So the second role is anesthetic associate. So anesthetic associates, these are medically trained anesthetic associates that work under the direct supervision of an anesthetic consultant. So maybe in some trusts they work on a 2-to-1 scheme where there is 2 theaters running with 2 anesthetic associates one in each, and 1 anesthetic consultant supervising 2 theaters. So then they only need 1 consultant per 2 theaters. So anesthetic associates will be doing the role of pre-op assessment of the patient, intubation, blocks, finals, basically everything that anesthetists do. But you have to be supervised. You can't work on your own. You have to be supervised by an anesthetic consultant. So what are the requirements of this anesthetic associate? So the first thing you need is, again, it's a 2-year course. It's a 27 months course. You do 24 months of learning, and then the last 3 months you'll be working and you'll be specializing into the field you want to do. So if you want to do orthopedics, trauma, then that's the time, the last 3 months you'll be specializing. But in general, it's a 2-year course. So, and during the time you're working, you'll be getting paid as well. So during the time, you're studying, you'll be paid at band 6, which is about 36k, and when you finish, you're at band 7, which is about 43k. So it's actually good money, jumping from band 5, 28k, to band 7, which is 43. So it's the sacrifice is worth it for 2 years. It's worth it, I think. So what are the requirements? So first, you need your ODP degree, or if you're a nurse working in anesthetic, you need a nursing degree, and you also need to have a 2-1 in your degree. So either above a 2-1, so either a 2-1 or a first class. So 2-1 degree. And the second thing, you need to have experience in the field. So you need to have worked in anesthetic itself. And certain unis, they say 18 months, certain trusts, they say 3 years. So just depending on the trust you're working for, and also the uni that trust is involved with, the uni that's running the program. So just like surgical care practitioner, so you'll be applying to the trust, that they're the ones that open up the post. You apply to the trust, and once the trust submit you, they have a connection with the university. They will be paying the university, and the university will be teaching you, and you're getting placement at the trust, basically. So the good thing about it is you're not paying for it, so you don't have to get loans, you don't have to get in a debt or anything, and you're still getting paid while you're training. So that's the good thing. And after you finish, you're getting good money. The disadvantage is it's competitive. It's very competitive. Like I said, these posts, they don't open up very often, and it's not a lot of them when they open up, and there's a lot of people that will be looking to apply for this kind of thing. So you have to make sure you stand out, and you have the experience, and you're good at what you do, basically, because the trust will be selecting you, and they've been seeing you working. So you have to have the attitude of wanting to learn and wanting to progress. Third role is physician associate. So physician associate is just similar to anesthetic associate, but anesthetic associate, you're only specialized in theaters. However, physician associate, is a generalized role. So these are medically trained professionals with a generalized role. They can work in any specialty. Now we're talking medicine, so outside theaters, in the wards. You can work in cardiac, basically all specialties. They're medically trained to treat and diagnose patients. So they'll be seeing patients, maybe you see them mostly in A&E. They see patients that come in and they're diagnosed. They order tests, basically make up a diagnosis and set a treatment plan for the patient, but however they cannot prescribe. So once they've made their diagnosis and they decided that, oh, this patient has this condition, they'll have to speak to a doctor, that's a medically trained doctor, who is able to prescribe, and then that doctor can review and prescribe. So the good thing about this course is you're not limited to just theaters. You know, it's a generalized role. You can work in GP, you can work in any ward, you can still work in theaters. I've seen some physician associate that work in surgeries. You're actually not just tied down to theaters only. You have the potential to go basically anywhere. You're not just limited to theaters. However, this is a master's, and you have to be funding yourself. So this is not funded by the trust. You don't apply through the trust. This, you're applying straight to the university that you want to go to, and you have to communicate with the university about the place and everything. They tell you their requirements, they tell you everything. The trust has nothing to do. Just like when you did your ODP training, you apply to the university and the university is in control of everything. And you also have to pay for this course. So you can apply for master's student finance, but you have to make sure that you've calculated your funding and it works out okay, because most likely you won't be able to work, because it's a very demanding course. It's a 2-year course. It's very demanding, because you're basically covering everything from anatomy to all diseases, and how you treat it, how you diagnose, how you examine patients medically, and how you make up a diagnosis. So it is a very demanding course, so it might be difficult to work. So you might need to save up before you go and start the master's. So for the requirements of a physician associate, you need to have at least a 2-1 in your degree. So you can't apply if you have a diploma. You need a degree, and you need to have at least a 2-1 in a healthcare degree. So in your class, you'll see ODPs, radiographers, nurses, biomeds. Anyone with healthcare degree can actually apply to this. And main difference between physician associate and the other 2 courses is during your physician associate training, you are not getting paid. So make sure you've done your calculations and some savings, because you won't be getting paid. Just like, you know, the anesthetic associate, you're getting paid at least a band 6, so you're getting a salary every month. During your physician associate course, you're not getting paid, because you're self-funding this. This is your own thing. The trust won't be paying you. Once you finish, you'll be paid at band 7. So the 4th course you can do, if you're considering career progression, is medicine. So if you feel like, oh, I want to have more progression, I want to not just end at anesthetic associates, I want to build up more from that, I want to become a consultant myself, I want to be more autonomous in the decision making, I want to be the one in charge in making all the decisions, then medicine is a good choice to go. However, it's very risky, 1, it's very hard, 2, and it's long. So this is the option I took myself, and it is a good option, but it's very tiring, very stressful. So there are 2 options. You can go for the 4-year degree, which is graduate entry. So if you have a degree already, you can apply for the graduate entry, and you need at least a 2-1. And also there are other requirements and other extra exams you have to do. It depends on the university that you want to go into. You can apply. However, it's very competitive, so you might have to try for a year or 2. Sometimes you don't just get in the first time. You can also go for the 5-year course, which is the undergraduate course, and it's less competitive than the graduate entry, but however it's still very competitive. There are other options available out there. There was talks about an apprentice degree coming through the NHS, so this might be things that open up in the future. So then that will mean the trust itself are funding you to do the medicine course. That would be good, because you don't have to think about the funding for the whole 4 or 5 years. And in the UK, if you're applying to the UK and you already have a degree, your student finance will not be the same. You won't be able to take student finance like you did your first degree. You will have limited access to student finance, and majority of the course you'll have to pay for yourself. So this will require a bit of planning before, and making sure that you're sorted your finances, and most likely you won't be able to work during your course. But however, after you finish, you'll be a doctor, and you can specialize in any field. So you can be an anesthetic, you can be a surgeon, you can be a GP, basically anything. And there's progression to that, and obviously your the money you earn progresses each year of your training until you become a consultant. So the last thing I want to point out is that these are very, very big career decisions. So they require a lot of planning and a lot of research. So you need to take the time for yourself, look around, research, ask around people that have done it, ask around. I am happy for anyone to email me or ask me questions about my career, my medical career. And also I just want to point out that the first thing is you need to think about your requirements. Do you have the requirements that are needed for the course you want to do? Is we know certain courses, they require you to have a degree. So if you have a diploma, then that's another thing to think about. Should you do a top-up degree? The second thing is also the grades as well. Do you have the grades required? Some courses don't require you to have a specific grade, however others require you to have a specific grade. So these are things to think about. And also look on the university websites. They do say as well what their requirements are. The third thing is think about the time. How long is it gonna last you, this course? Some courses are 18 months, some courses are 12 months, 24 months, some courses are 4 or 5 years. So are you able to take that time of work, and are you able to sacrifice 2 to 4 years of study without earning full time, without interacting with people as much as you used to, because you'll be so occupied as a student. The third thing is, I would say, make sure that your job, you have a job afterwards. So I would recommend just go on NHS jobs and just search around, and you get a feel of what kind of jobs are available for the course you want to do, because some jobs are very limited to where you can work, and also the specialties you can get and where you can go. So if you're someone who doesn't want to be restricted in a certain area or environment, then have a look around on NHS jobs and see what's available out there. So this gives you a bit of an idea if this is suitable for you or not. The last thing is funding. Please make sure you do calculations of the funding before you make sure, is this self-funded or the trust is paying for me, and if they're paying for me, do I need to pay back? Because certain trusts will give you conditions, like maybe you need to work for them for 3 years, and if you leave before the 3 years, you have to pay back that money. So these are things to look at. Otherwise, if you're considering career progression, I wish you all the best, and if I can help in any way, do contact me and I'll give you any advice I have. But yeah, thank you so much.